As many as 1/3 of young people are not getting educated about the dangers of tobacco use. That's why Norton Healthcare reached out to Pleasure Ridge Park High School to create a specially designed anti-smoking campaign for students. Janita Lyons from the Norton Children's Prevention and Wellness Division collaborated with the class throughout the project.
So tobacco use is still associated with many chronic conditions. And so at Norton Healthcare, we offer cessation resources, tobacco cessation resources for adults. So we knew we needed to do something for young people as well. And so at Norton Children's Prevention and Wellness, we were thinking about what's the best way to approach the messaging around tobacco control to young people. And we decided it really should come from the source. It should come from peer-to-peer education.
The campaign being spread will reach at least 10,000 JCPS freshman students per year.
So I was connected with Denise Webb, a teacher at PRP design class, to really brainstorm this issue and for the initiative to come from students so that it's peer education.
For this project, we did different research about the negative effects of tobacco and tobacco-related use. So, for instance, we researched what hookahs did and what the smoke did to your lungs and whatnot, in association with the actual nicotine and stuff like that.
Ditching the traditional method of experts giving the statistics, Lyons found that spreading the message can be more impactful using student-to-student education. PRP's design team stepped up and created a campaign using PSAs, graphics, social media, and an interactive Kahoot game.
They came up with different kind of avenues to get the message across, whether it was through social media, videos, and they started an Instagram page. So it was really cool to see the progression of the project.
We also use the PRP tobacco-free Twitter account. So with that, we connected with different students, organizations, and whatnot to help bolster our idea of being tobacco-free.
With the Kahoot game, the students are able to take the campaign into the classroom, getting kids more involved in a way they understand.
Has more than tripled.
So it's this little internet game where different students in part of the class could pull out their phones and answer questions on the screen. And you get points for answering correctly and answering fast. And you don't get any points for getting it wrong.
A man familiar to the statistics that detail the harmful actions tobacco can make on a teenager's life is the division president of Norton Healthcare, Dr. Steve Hester.
One of the big things with tobacco, certainly it's the most preventable cause of death in the United States. And so when you look at, teenagers and children in terms of the risk of smoking, if you don't smoke before you're 19, 90% of smokers started before the age of 19. And certainly taking that time off of your life and the challenges that come with health and long-term activities can be prevented. And so it's really an important thing for kids not to smoke at an early age.
Though the project is taking place in the classroom, Norton has already put the material into the patient's eye.
We actually at Norton Children's Hospital have put the material in our practices. And so as kids come in to be seen in the exams, they actually see that material there. And so that impact isn't just, just with the game, but it's with the materials that we have there. And certainly today, young individuals really want to interact in a lot of ways with and like the game concept. And so I think it's a great idea that your colleagues have come up with to create this content and really do something that's going to have a long-lasting impact.
As for the importance, he can't stress it enough.
I see so many people who end up with health consequences from smoking. And so in the end, I can tell you I've seen a number of folks who've had lung surgery, who end up having tracheostomies, who've had heart attacks, who know those are related to smoking and really look back on their life and say, I wish that I hadn't. And as a young individual, you don't always have that ability to see that, but I see it often. And so the real opportunity is how do we have an impact on those kids at an early age so they don't end up in that situation. So they don't have 13 years taken off their life.
Well, this is important so that students can actually feel good about themselves without relying upon drugs or any addictive substances.